So you can kind of listen along.
I'm gonna lay on my side.
You're fine right where you're at. If you're comfortable, it's okay. So this little guy right here is your like access point. So you just want to get an alcohol swab. I'm collecting a sample right now, and then I'm gonna flush it.
Okay.
So you just want to clean this really good. So friction is what gets it clean. So just scrub it for, you want to do like 10 to 15 seconds. Just so you're not introducing bacteria into the line. And then I'm gonna put this one's empty because I'm collecting, I'm not flushing yet. And then this says off, so you want to go off to the bag. So whatever this is pointing at is what's like off. So right now this connection is going between here and inside. So pull back, and it's thick, so if it's hurting you, tell me. I don't know if we're gonna be able to collect too much. Are you doing okay?
Yeah, right.
So there might not be a lot in there, so I'm gonna just pull from the bag, from the line, if it'll let me. It's thick. I don't know if they're gonna be able to even test this. So I called the lab and I was like, can we add on that test? And they were like, it's way too thick, like the output. So now I'm trying to pull it back and I can't even like pull any.
Why is it so thick?
Just because there's like pus and blood and there's just a lot of content to it. So, what I'm gonna do is flush and then try to pull back on it. Let's see.
Doing okay, babe?
Does it hurt?
I don't know. Just I feel pressure, that's it.
So you want to do 10 every time, and the whole syringe is 10. So you don't have to measure anything. You just push the whole bit in, and then this is self-occluding. So.
Oh, so you just put liquid in there right now?
Leak. Yep. So I just put 10 cc's of saline in there, and now I'm gonna try to pull back on it and see if I can, because I thinned it out a little bit. Maybe have better luck. It's pretty thick still. Better. Okay. And then when you're done, if you forget to turn this back, it's just going to be collecting in there, which the whole point of this drain is to let it out. So you want to make sure you turn this back to off so that it can flow through there.
Okay.
Because when you're turning this, it's blocking this tube and it's just between here. But when this is off, it's going straight out into the bag. Sorry.
Okay.
So don't forget to turn that back. That's like one of the most
pointing out how it is now.
Yep. Keep it clean, flush it, and make sure you turn this back.
Okay.
And that's that. Okay. So we're all done.
Yeah.
I'm gonna put this in here, and we'll see if they can run.
And then does he dump this in the?
Yeah. So you guys could probably, depending if you go home and you start having like a lot more output, you can dump it more frequently. At this rate, I would say, when it gets to 100, you can just go to the toilet. And then all you do, here, let me get rid of this and I'll tell you.
Okay.
So I'm not playing around with a syringe. Thank you very much. So, yeah, whenever, and you can use your judgment. There's no, if you do it a couple times a day, if you do it once a day, as long as it's not like full and backing up into the line, that's all we care about.
Okay.
But all you do, this bottom is vented, so you can just stand over the toilet and then you just untwist it. And since it's thicker, you might have to kind of fold it and push it like milk it out essentially. And then you can just swab it off, wipe it off with a wet washcloth and tighten it back up. But super simple.
Okay.
Yeah, but other than that, and then they're gonna have you follow up outpatient, I think in a couple of days with the surgeon.
Yeah, I just talked to him.
Okay, perfect. So depending on output, if you're having like barely any output by like Wednesday, they might call you in to pull it. But yeah.
All right.
Any questions? It's pretty straightforward. It seems like a lot, but once you do it, you're gonna be like, oh, that's not so hard.
All right.
And if you do get home and you're like, oh, I forgot what she said, or the video is on silent or something, you can always call your surgeon too and talk with them. And yeah.
Okay.
Signs to watch out for like infection. You're on IV antibiotics, so I don't expect you to be having any infections going home, but just things to be aware of at the site. If it's like red, tender, like hot, if you get a fever, if you check your pulse at home or you just feel like your heart's like pounding, call your surgeon and let them know. I don't expect any of that to really happen for you, but it's better to be aware than not. But yeah, just classic signs of infection.
Okay.
And you'll be looking at, like, if you shower every day, you'll be looking at that site anyway, so just inspect it real quick.
How does he shower
She
with
gave
the
me a-
cotton?
I gave him.
Oh, okay.
So these guys. So usually we use these for like IV sites inpatient.
Okay.
But it's same. So you just take these borders off. They're sticky. And the bag can hang out. It's fine if that gets wet, but you can just put it right over those gauze.
Nice.
And then when you get out, you can just dry off and you're good to go. There is something similar to this over the site anyway. So this is kind of just double protection.
Okay.
And you can't even see it. It looks like my skin or something. Yeah.
And then I'm assuming they'll do the first dressing change at the surgeon's office. But if your dressing gets like totally saturated, I don't expect that to happen. But if it gets like super bloody and icky, you can call them and let them know. Maybe they can get you in sooner, but I'll send you home with stuff too. Just so you can change it if it's like smelling or something.
Oh, all right.
Yeah. And then it's super easy to change it, and it's stitched in place too. So leave that stitch there.
Okay.
But the gauze and stuff you guys could change if you need to.
Okay.
But if it's not like saturated or anything, I would leave it. Just let it be, and they'll take care of it at the office.
Nice.
Yeah.
Okay.
So, any questions? Anything I didn't
No.
answer? Okay. I'm gonna start working on your discharge paperwork and stuff.
All right.
I'm gonna let you have your IV running as long as possible, so we'll take that out very last,
All right.
just so you can get as much of the antibiotics as possible.
Okay.
And then I'm gonna send you guys home with plenty of flushes. I'll get you some alcohol swabs, and I'll grab some gauze and stuff just in case you do have to change it.
Nice. Thank
Okay.
you so much.
Yeah,
You are
thank you.
welcome. And I'll get a bag to put all this in too.
Thank you.
You are so
You've
welcome.
helped a lot.
Yes, no problem. Thank you. Okay.
Thank you for letting
Thank
me
you.
know.
Of course.
Doing okay?
It's a little sore.